everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do. Hi, this is kind of an unusual video because I don't usually wear suits. I've owned 2 suits in my life, and I typically only wear them for special occasions. I actually bought this one for Mike and Paula's wedding because my only other suit I had was from high school. And this is certainly not running, but my friend Eric Rifkin and I just made a video, as we do, about health outcomes, and it's always fun to do that. And we're in Baltimore, and so I figured I'd film something. So here I am, walking in my suit through Baltimore. I wanted to talk a little about, and this is going to be a 2-part video, about things that you learn that aren't always accurate, and the way people can manipulate health studies to make them seem like they are more impactful than they actually are. And we're going to talk about atrial fibrillation today, and then next week we're going to talk about osteoporosis, or bone loss. So atrial fibrillation is one of my pet peeves as a doctor. There was recently a cardiologist who told my patient that I had no right to even discuss atrial fibrillation because what do I know? I'm just a primary care doctor, and I'm always disagreeing with how they present information about it. Atrial fibrillation is an abnormal rhythm, and it's a rhythm of the heart, and it goes irregularly. And the big danger of atrial fibrillation is that because the heart's going irregularly, clot can build up in it, and you could actually get a stroke. That clot can come off and lodge into a blood vessel in your neck or your brain and cause a stroke. And that's really the biggest issue we have with it. And so how do you prevent the stroke? And that's what treatment of atrial fibrillation is. One of my patients was found in the hospital to have atrial fibrillation, and he was told by his cardiologist, this same cardiologist, that if he did not go on a blood thinner right away, that he would get a stroke possibly by the time he got home. I mean, that's how serious it was. And I've had several patients actually who decided not to go on blood thinners and were kicked out of their cardiologist practice. They said, if you're not going to do this, even Eric Rifkin, who I work with, was offered a blood thinner when he was in the hospital, and he knows the risks and benefits, and he said, look, this is really dangerous. And the doctor said, what are you, an idiot? What are you, an idiot for not going on this blood thinner? You'll get a stroke. And that's what they say. They say people who go on blood thinners, like Coumadin or Eliquis, warfarin, Pradaxa, there are a lot of them. You see them on TV, advertised all the time. Then you often see a lawyer ad coming right after it saying, if you've been on this drug, call us. Because there are problems with these drugs. But they're part of the religion of the cardiologists. They give them out, that people who don't accept this gift from God, this drug, are somehow negligent and they're going to get a stroke. And that's how it's pointed out. My father recently went into this rhythm, and he got the same speech that they all get, and I had to talk to him about it. Mike's dad too. I actually had a patient who had fibrillation, and the cardiologist was just adamant about them being on a blood thinner or else they'll get a stroke. But the patient was bleeding, actively bleeding. And I called the cardiologist right from the patient's room, and I said, we got to stop this drug, and the patient's afraid to stop it because you told them they're going to get a stroke if you don't stop it. And the cardiologist said, well, I'm really nervous. I said, yeah, but what about the bleeding? And the cardiologist said, well, the chance of bleeding is pretty low. I said, they're bleeding. The chance of bleeding is 100%. And the cardiologist said, no, it's lower than 100%. They were bleeding. Anyway, when you go on a blood thinner, there are dangers and there are positives. And a lot of times the cardiologists give you an exaggerated view of the benefit. So they'll say there's a 50% reduction in stroke if you actually go on this blood thinner, which is technically true. Because again, that's a relative benefit. And who knows what that means? 50% of what? If it's 2 out of 1,000 and it goes down to 1 out of 1,000, that's still 50%, but that's a tiny benefit. So, and when people I know go to the cardiologist, they say, well, your chance of getting a stroke will be 4% a year if you don't go on this. So, and that's a made up number. So you can determine what is a stroke. A stroke could be determined in one of these studies A stroke can just be they did a CAT scan on your head and they saw a new dot on the CAT scan. You had no symptoms of anything and they count that as a stroke. And if you count those things as strokes in these studies, yeah, it is about a 4% reduction in stroke in a year. But then you could use the word disabling stroke, which most studies don't use. A disabling stroke is a stroke that causes you symptoms that stick around. Like my right hand got numb and weak and it's not getting better. That's a disabling stroke. That's the kind of strokes you care about. So the studies that look at stroke in general, that's a meaningless number because it's made up. Disabling stroke is what we want to know about. And very few studies talk about that. You got to dig into the study. I wrote a chapter on this with Eric Rifkin, and we did dig into the studies and we found out what the numbers were. And we've confirmed these numbers with other people. And the cardiologists that I know in my community do not believe these numbers at all. And they tell patients other numbers. I had one patient who came to me and said, the cardiologist says that if I don't go on this medicine right away, I'm going to get a stroke. And you say if I go on it, I might bleed. So I'm going to screw both of you and just take half the dose. And you'll both be mad. And that's the way it goes. And I thought that was a funny way to deal with the fact that what I'm saying and what the cardiologist is saying are so different. But here's the reality. And I'll show you some theaters to just illustrate this. This is what the cardiologists say. They say for every year, out of 1,000 people who don't take this drug, about 40 of them are going to get a stroke compared to people who take the drug. So when you don't take the drug, it means you're taking something like aspirin, which is pretty good too. So 40 extra people, that's the number. So there's the graph, how many people they say are going to get a stroke. Now here's the graph I use. That out of 1,000 people, about 6 people will get a stroke. A symptomatic disabling stroke in a year, people who don't use it compared to people who use it. So in other words, if you don't use this drug, there is a 6 out of 1,000 increased chance you might get a stroke. That means 994 people out of 1,000 don't benefit from this drug. And that number over the years does not accumulate. As the years go on, the number shrinks. The highest risk of a stroke is in the first year. So after many years, if you haven't had one, you're probably not going to. Now, just taking an aspirin alone has some benefit. Here's another graph. Here's another one. We're going to show kind of the same theaters. Here's another one with 40. So this is the amount of people who take this drug, one of these blood thinners. 40 extra people out of 1,000 in a year will have a major bleed, a bleed significant enough that it lands them in the hospital. That's something you should tell a patient, that this is possible, especially if they're prone to bleeding. And here's another one, again, same number, it looks exactly the same. So approximately in a year of people who take the drug, about 6 people out of 1,000 will either die or bleed into their brain. So again, 6 people will prevent a stroke, 6 people will die or bleed into their brain. The number could be higher or lower. One of the cardiologists said to one of my patients, well, you have a lot of sickness, so your number is 3 times higher of getting a stroke than someone with low risk. And I said, that's true. People with low risk, the number is about 3 out of 1,000, and people with high risk, it's about 9 out of 1,000. That is 3 times higher, but 3 times very little is still very little. So again, this is a deceptive way to give them information. That's why I'm illustrating this. People are told to go on these blood thinners because if they don't, they will get a stroke. And yet the risk of stroke is really low. And the risk of bleeding is equal to getting a stroke. So it's kind of a wash. 0.5% of people will bleed in their brain, 0.5% will get a stroke, will avoid a stroke. What do you do? Well, as I said to my father, that means about 99% of the people will neither get a stroke nor bleed in their brain. So you're probably okay either way. But if you're someone who falls or is prone to bleeding, or if you're like my father, a very bad car driver, you may not want to go on these medicines. Because if you get in a car accident and you're on a medicine like Xarelto, which everybody's pushing, and you start bleeding, that bleeding will not stop. You will bleed for 3 days. There's nothing in the world they could do about it. Or if suddenly your appendix ruptures and you need an emergent surgery and you're on that medicine, you're in big trouble because you're gonna bleed. And that's why these lawyer ads come up, because cardiologists do not tell people the extent of the danger of the bleeding. They only tell them these very faulty numbers about their risk of stroke. and tell them they're going to get a stroke, or there's a 50% higher chance they'll get a stroke. You know, these faulty numbers that don't tell the truth. So the reason I like talking about atrial fibrillation is because it is one of the examples where we doctors can exaggerate the benefit and minimize the risk. And what we're going to learn, and what studies have shown, is that 90% of doctors, when they tell a patient about an intervention, get the numbers wrong. They maximize the benefit and minimize the risk. That's what doctors tend to do. We believe in interventions. And going on a blood thinner for atrial fibrillation is a perfect example of how we do that. And we cause people a lot of harm and a lot of stress and a lot of angst. And I have a lot of patients who are on these blood thinners who should not be. They're falling, they're bleeding, and they're afraid to get off because the doctors told them they will get a stroke. Chances of stroke are low. You have a higher risk of many other things. So next week we're gonna apply the same logic to treatment for osteoporosis, and we'll see how some of the studies are using faulty information and exaggerated numbers to try to convince people to do something that may not be in their best benefit. Okay, take care. Hey, hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.